Snail mail, our newsletter. If you did not, we have copies up front. Just raise your hand and I'll get copies to you. This afternoon we have speakers from Hawaii Meals on Wheels and Lanakila, from the Rotary organization. Let's see, I know from HPGS, and thank you. And then we're waiting for Kealii from AARP. We have a short presentation, an appreciation ceremony, if you will, for our outgoing president, Jim Sean. Jim, if you would stand, please. To doing this. This is a certificate of appreciation issued on February 24th, 2020. The Kokua Council hereby expresses our sincere appreciation to James Sean, PhD, in recognition of your ongoing contribution as a leader in strengthening services to our island's kupuna. We value what you have accomplished as the City Kokua Council's interim president, and we look forward to your continued advocacy.
Yay.
I'd like to thank the Academy for this award, our cinematographers, our sound crew, backup, our writers, our food caterers, and all these things, and all of your participation over the years, because it was basically allowing me to walk ahead of the parade that you were leading. So thank you very much.
Thank you, Jim, for all your leadership. We hope to follow in your footsteps as well as you let us. So we have a few people, like Lila said. So I'm Rick Tabor. I'm the new vice president for the Kokua Council, and I'm the programs person. So if you have a program that you want us to do, let us know. If you have an interest in a program, let us know, okay? So there's many things coming. So we're going to start with Meals on Wheels, both of them, Hawaii Meals on Wheels and Lanakila. So Laurie and Michelle, you're out. You gonna sit there?
Yeah. Okay. Good morning. Thanks so much for having us. I really appreciate having being a part of Kokua Council, coming to the meetings. Thank you, Jim Sean, for advising us on many levels. Mahalo. I'm Michelle Cordero. I'm the CEO of Hawaii Meals on Wheels, and we serve hot, nutritious meals throughout almost all of Oahu, from Kapolei to Wahiwa to Town to Waimanalo and all of Windward Side. Our volunteers are there to serve hot meals for our kupuna who are homebound. And these are kupuna who've been assessed either by the city or by a private agency on not being able to warm up their meal, cook. They have a number of chronic medical issues. And for many of our clients, almost 60% of our clients have some sort of medical meal, meaning that they are diabetic, renal, chopped, pureed, and our over 400 volunteers deliver to them daily. Our average age is 86 years old, and majority of the clients we serve are women. And just in 2019 alone, we served, out of the 800 clients we served 20 clients over the age of 100. So that is just very telling of where we are headed as a community. I have pamphlets in terms of if you have questions regarding volunteering or are interested in a neighbor or an aunt or an uncle who may need a meal. So I'll leave that up here at the front. But I also want to thank Lori, who I pulled up here at the last minute, because when I'm a lot of times introducing our service, it really is in conjunction with other Meals on Wheels programs out there. And Lanakila Meals on Wheels is the largest organization, and Lori can tell you a little bit about what they do.
Thank you for letting me have part of the time. So Lanakila Meals on Wheels, we serve a very similar population to Hawaii Meals on Wheels. We have some individuals that receive hot meals from us. Those are normally individuals living in the Honolulu area. We are a island-wide Meals on Wheels provider, so those living outside of Honolulu and especially in the rural areas take frozen meals from us. The frozen meal deliveries then come once a week, and they receive an entire set of meals in that delivery. Lanakila Meals on Wheels also has Kupuna Wellness Centers. Our Kupuna Wellness Centers are open to the public. It's a lifestyle and activity program for seniors free of charge. Really, the Kupuna Wellness Centers are focused on their cognitive, physical, social well-being, and we also serve a free meal at the Kupuna Wellness Centers. There's 8 different locations where someone can connect with us to receive that meal. Being an organization that is concerned about senior hunger and people not having enough resources in order to continue to be fed, we are also a SNAP outreach provider. So if the reason why you don't have enough to eat is you simply can't afford it at the end of the day after you pay off your bills, we will come to you, we will help you sign up for SNAP benefits, and then you can use that benefit at a grocery store, at a farmer's market, or you can pay for your home delivered meals using the SNAP benefits if you are homebound. And we also, I passed around these flyers to some folks. We have an event coming up focused on senior hunger in Hawaii. Unfortunately, 1 in 6 of our kupuna are food insecure. And so it's something that we want to raise awareness about. This is an annual event that's in conjunction with other March for Meals events across the nation. And so if you are free on March 17th and want to come down to the Capitol to take a stand against senior hunger, we'll be there at 9 a.m.
So we're going to do questions right at the end. I'm going to have everybody speak first. So jot down your questions. Everybody's going to stay here for the whole thing, and then we can ask questions right at the end. That way we get everybody up and speaking. Okay? Is there anything else you wanted to add? So next, so by the way, I'm in all these groups doing things. So the next up we have the Rotary. So we have Calvin's going to speak to us about what our Rotaries are doing here in Hawaii for kupuna. So Calvin Hara is going to speak to us, and he's from the Sunset Kahala Rotary. I'm in the Club of Honolulu, and we have Naomi here as well, who is our district governor-elect for all of Hawaii. So we have Rotary representatives, and there's a few other folks that Naomi was pointing out that are Rotarians also that are here. So Rotary is in the house.
Hi, good afternoon, everybody. So, as Rick said, probably everyone in here has multiple hats in career, in your everyday life, as a volunteer, church, etc. So when Rick approached me, he said, talk about what Rotary does for kupuna. There's over 50 clubs in the statewide for Rotary on the islands of Oahu, Kauai, Maui, and Hawaii Island. So as each club, in their own community, do community service, and that's really the heart of Rotary. Service projects for the community locally, for the state, and internationally. And when Rick said, well, talk about what you do for kupuna. Actually, Rick said Sunset Club, I'm the Sunrise Club. So I'm the morning person. So it's called the Kahala Sunrise Club. So I'm going to talk a little bit about two projects that we are doing annually. And Naomi can add more to what Rotary does, maybe for her club and other clubs too. But these two projects that our club does, I'm sure you know about. One is related to Alzheimer's, with the Alzheimer's Association and the Aloha chapter and the Walk to End Alzheimer's. The most recent walk was November 9th last year. And our club provided a sponsorship as well as a team. And the team to walk, in any kind of walk, is to bring awareness to the community and to support the event that, hey, we're here together to talk about Alzheimer's and other dementias, which, as we know, greatly affects people in their older years. In fact, those who are over age 90, about 50% at least will have some type of dementia. So with that, our club, will get the word out about the need to bring awareness about Alzheimer's at different levels. One is for the caregivers who support and help their loved one with dementia or Alzheimer's. The other is awareness to bring more advocacy to our elected officials that we need to find a cure and treatment for Alzheimer's. So that's the message our club members bring to the community, centered around the topic of Alzheimer's and other dementias. Another project our club does is related to dementia as well, and this is what, I'm going to pass this around, is a summary sheet on Dementia Friends Hawaii, and it's part of, the University of Hawaii Center on Aging, as well as the age-friendly program within the city and county of Honolulu. And so our club went through training, which is called the Champion Training, or Train the Trainer. So we are able to do training in any setting. This setting, church group, friends, employees of a company. So since the last 2 years, when this program was introduced, we've done almost 20 sessions on Oahu. So we're very active with bringing awareness, and the awareness on Dementia Friends Hawaii is how we can help people in the community to make a difference for someone with dementia so they can have a very fruitful life, although they have an illness, that they can still be valuable resource and participants in the community. So those are kind of two area programs that my club participates in. There's other, of course, Rotary clubs statewide, and I'm sure Rick may have shared with you about one involving hearing aids, and what's the other one? I don't remember. Hearing aids, and your club has another one? No? Oh, okay. No, I'm done. So, Naomi?
Thank you. My name is Naomi Matsuno. I'm the incoming governor for Rotary International. Rotary is just so widespread, and every club has its own flavor, its own projects that are pet to them. Some of them might be working with students at the elementary school, the high schools, the middle schools, leadership training. We do kupuna, senior care projects, but the main focuses for Rotary International would be disease prevention, maternal health, hunger. There's so much to Rotary that suits you. So if you're interested in joining a Rotary Club, it could be just for the fellowship, because keeping active is another good thing for seniors and young ones. And the wealth of information that you have to share to people that are up and coming in their careers, to kids in the schools, is valuable to have this partnership. So if you're interested in Rotary, in helping your organization, because we do a lot of projects. We have 53 clubs around the state. We do projects all around the state. We've Lanakila Center, Senior Center, we did a cleanup project with Suzanne Oakland. We do Meals on Wheels. We do all kinds of projects all around the state and globally. So Rotary is a humanitarian service above self organization, and we welcome input from you, partnerships, and membership, of course. Thank you.
Thank you, Kelvin and Naomi. Also, Percy's magazine here, Generations, actually, this one that just went out, if you look at this one, get it backwards. The hearing aid program has made the cover. So I always joke, when I was younger, I remember Dr. Hook and the Medicine Show, cover of the Rolling Stone. We made the cover of the Generations. So it's on page 58 is our hearing aid program. And a few months ago, we had Robert come from Miracle Ear and talk about the program that we're actually doing. So the program is actually to give hearing aids to folks that live under the poverty line. So if somebody makes less than $23,750 a month, we'll help cover the $150 application fee for free hearing aids from the Miracle Ear Foundation. Now, I recently just connected also with Ohana Ear, and there's some other hearing aid things that we may actually be doing here in the future. So hearing issues is definitely an issue, and we had a whole presentation around that, and most of you guys were here for that. So there was that. Naomi and I, we actually hung out a couple weekends ago. We were at Camp Ryla, so Rotary Youth Leadership Awards, totally different, but we had 42 kids that were in attendance, and Naomi gave out the graduation certificates. It was a long weekend. I've just now recovered, actually. So next up, we're going to have Eileen Phillips from HPGS, which is Hawaii Pacific Gerontological Society. Eileen's this year's president. President-elect Debbie is over here as well. And we have the executive director in the house. Where's Sherry? Sherry's over here as well. And I'm on that board as well.
Thank you. Aloha kako. My name is Eileen Phillips. I am just newly elected to the HPGS board as the president. Very happy to be doing this. I've been on the board for 2 years now, so I've learned a lot just being on the board. And there are a lot of board members here. So has anybody other than the board members that are here ever heard of HPGS? One? Okay, good. So I'm here to tell you a little bit about what this organization does. It's a wonderful organization. It's actually been in existence since 1979. So I'm surprised that it hasn't really made its way in the community. It has a great mission, and I'm just going to read you some of those words from our mission so that you understand our goals. The goal of the Hawaii Pacific Gerontological Society, well, first you have to learn how to say that really well, right? Is to enhance the general well-being of older individuals in the state of Hawaii and the Pacific Islands. So it's not just the state of Hawaii, it's also the Pacific Islands, which I did not know that until I got on the board. How do we do this? We foster public understanding and continuing education in the field of gerontology. We bring together all people concerned and interested in the challenges, issues, and problems of the older adults as realized in a changing society. And this society is really changing. This was written back in 1979, I'm guessing, so they knew what was to come. Advocating on behalf of older people in Hawaii and the Pacific Islands, stimulating interest in gerontological research and services, encouraging professional preparation for gerontological research and services, and promoting volunteerism in the field of gerontology. So I've learned a lot about being on this board, but one of the things I've learned is that we do a lot. We communicate a lot, but you got to be a member to get the newsletters. So part of what I'm here to do is also promote membership. That's one of my goals this year as president, is to increase our membership. So we do have membership forms over here, if anybody would be interested, after I tell you the benefits of being a member. So the benefits are you get a newsletter every month, and the newsletter has tons of information in it on events, workshops, there's educational stuff that you can read about. I have a message in there every month that talks about some things that we're doing on the board. And it's a good place to sort of look at what's going on in the field of gerontology and our kupuna. So that's one of the benefits. The other one is we've started doing these monthly webinars, and they're online, so you can just sign up for them, you can get on, you can see what the educational topics are, and to get the topic, you get the newsletter, so it'll be monthly, usually the last Thursday of the month. And it's really easy. You just sit in front of your computer and you learn a lot of information from community members like yourselves. And we're always looking for people to come and do those webinars for us. The other thing you get is we've started doing general membership meetings every quarter. And at these membership meetings, we have people, again, come in and do an educational presentation, sort of like what we're doing here. And they talk about their organizations. We've even had a legislative review come in this past year. We had 4 membership meetings last year, and all of them were really exciting, I thought, because they had really good information about what's going on in the legislature. The other thing we do is have big events. So every 2 years, on the even year, we have what's called a biennial conference. And this is where we bring people from all over the world, if we can get them, to come and speak about elder issues. And this year's theme is 2020 Vision. So what do you think that talks about? It's not about eyeglasses, okay? It's going to be about research-based, evidence-based, research-focused topics that are up and coming for the future for our kupuna. And we're starting to look at bringing in presenters. So if you go to our website, www.hpgs.org, you'll be able to log on and see some of the things that we are working on to get this conference going. It takes a lot of effort, but it's a 2-day, let me tell you the dates. It's September 10th and 11th this year. It'll be at the Ala Moana Hotel. There's breakfast, there's lunch. It's a really fun couple of days. They're full days. There's some networking after one of the days. There's an exhibitors room that exhibitors can come. So if you know anybody that wants to be an exhibitor that has products or services for our senior community, this is a good venue for them to be at. There's also a way to sponsor the conference, which we're looking for sponsors as well. So that website has everything you need to know if you're going to be involved in this conference. It's going to be a good one this year. So the other thing that we do is we offer scholarships. So this is really an amazing thing that I thought was really, really cool for HPGS to be doing, because the scholarships are focused on people who are going into an educational field that has to do with gerontology. So it could be a nursing field, it could be social work. We have graduate and undergraduate programs, scholarships, and these are all funded by our fundraisers that we have during the year. Usually we have a big dinner sometime in the fall, and that brings in a lot of the money to fund these scholarships. So look out for that too. So if you become a member, you'll get to see all of this wonderful stuff that we're doing and be a part of it. I'm trying to see if there's another benefit. Scholarships, biennial conference, there's a lot. So I've been really, what was that, Percy?
How much does it cost?
How much does what cost? The membership? Why don't you tell me? Because I know there's different categories. Membership, it's on the form. I have one of the forms here. Okay, membership. It is $10 for individuals 65 and over, $20 for individuals under 25, $80 for individuals 26 to 64, because I guess those are the people that are still working, right? And $100 for companies or organizations, and that includes one person in that company. If you want to add more people in that company, it's just $50 more for each member. So it's a range of prices to become a member, but it's really worth it because you get a lot of really good information. And I'm really glad to be a part of it. So thank you for listening.
Thank you, Eileen. And the webinars are open to anybody. Anybody can log on and take in the webinars, okay? And they're all archived also. So, so next up, we're going, after the next presenter, then we're going to open it up for questions, okay? So next up we have Kealii Lopez is the new executive director. Well, actually not so new anymore, for AARP. So she's going to say a few words on Hawaii's AARP. Thank you.
Aloha, everyone. Rick, thank you for inviting me, and thank you, Dr. Schoen, for your continued advocacy. I'm very lucky and happy to be part of the Kokua Council's work to ensure all our shared organizations can find a way that we can work together and leverage our efforts. That's one of the things that I really want to be able to see ARP do, which is partnering with others to help, not just ourselves, but others be successful. A good example is we are working with different organizations, although we provide training ourselves or workshops related to caregiving. We've also started partnering with other organizations that perhaps do a little bit better job at some of that training and using our network of getting the word out and sponsoring those events rather than duplicating the effort. So that's one of the things that I want to see us do is rather than duplicate some of the work, is find out where those gaps are and see where we can help other organizations meet their objectives and goals, especially because we have a shared interest in meeting the needs of kupuna. And I'm very clear it's not a competition, and there's more people who need help than there are organizations to actually meet those needs. So with that, I wanted to share a specific area of interest for ARP Hawaii. And the challenge for it is we haven't been able to get traction, which is interesting because I think this is our 5th year at the state legislature to try to get what we call Hawaii Saves passed. For me, it seems pretty straightforward, and the focus is on saving for retirement. It was interesting to hear that 1 in 6 seniors require support as it relates to Meals on Wheels. I want to share some statistics from a report that was done by the University of Massachusetts in Boston. It's called the Elder Index Study. And according to that study, more than half of Hawaii's kupuna living alone lack the financial resources to pay for basic needs. Many of you who work with them already know this. Nearly 27% of older couples in the state also risk being unable to afford to live here. The other point it brought up was the study indicated that 7.6% of older couples in Hawaii live in poverty. This is the highest percentage in the entire nation. There are steps that lawmakers can take to make it easier for working families to save for retirement at work. We can also help, which we have been trying to work with, and I want to share a couple bills with you, to cut the cost for prescription drugs and ease the financial burden for working caregivers. According to the study, kupuna need a minimum income of $32,048 for singles and $44,700 for couples just to get by. This is not going out to restaurants and going on vacations. The cost is even higher for those in poor health, with $34,728 for singles and $48,780. The reason I want to bring this up is many people for a long time have seen Social Security as a way to prepare for the future. Social Security is no longer what will help people prepare for the future if it's the only thing they're counting on. More than half of kupuna whose incomes fall below the elder index minimum rely on Social Security at least 90% of their income. Okay? So that's more than half of kupuna whose income fall below the elder index minimum rely solely on Social Security, 90% for 90%. Again, I'm spending a lot of time on this, partly because my concern, or our concern at AARP, is that it's kind of like the iceberg. People cannot, or worse off, it's like climate change. People don't see the problem today. They're maybe barely able to make ends meet now, but don't recognize that as they get older, their ability to earn income, the cost of living, their health care requirements are going to be far greater than they are today. And one might imagine as a young family that absolutely caring for and raising children is very costly. But I think as many of you know who care for your loved ones, your parents, a spouse, those healthcare costs at some point seem to at least feel like they far exceed the cost of raising our children. The other issue is pensions used to be a big part of what a lot of Americans could rely upon. My mother, who's 82, is able to continue to live at home. We have my family. She suffered a stroke. We all take turns. It's literally a village. 24/7, we as family members are able to work and take turns taking care of her, so she doesn't have to go into a home. But she's able to live on her own. She has her own home. It's because my father worked for the federal government and has a pension. She's able to do that. If not for that pension, she would be struggling significantly. There's not as many pension funds available. We're clear that almost half of Hawaii's workers do not have access to easily save for retirement through their work. That's about 216,000 individuals who are unable to easily save. So again, I'm sorry I'm spending a lot of time on this, but it's because the future is very bleak. Because if we aren't clear, there is already a retirement crisis that's going to continue. So the challenge we have is how to get legislators who perhaps in their own upbringing were really good about saving. It's a habit. Some of us learned early on to save, to invest, had the opportunity to sit with a financial planner to do those things. But most people have not, and especially those who are basically our working poor. So I wanted to share that with you because the House bill died, and it was a task force. We thought we'd go with a task force, hoping that that was something that we could easily pass. But for whatever reason, the House bill died. We're eager to be meeting with the House leadership, and I'm glad they've agreed to meet with us. I'm meeting with them tomorrow to try to get the Senate bill to make it through the House. Sailed through the House, standing up the program, sailed through the legislature last year, but now a simple task force has died. So the concern is that there are competing interests, and we understand what those are, which is maybe if it's too easy for people to save, they're going to go through this program that the state stands up and don't use other means. We hope that that's not going to be the case. So one, we just wanted to make sure you know that even though that's our priority, AARP is still very much involved in looking at and addressing issues for caregivers. We're participating in legislation related to kupuna caregivers. We're participating in legislation related to decreasing the cost of prescriptions. There's several out there. One's a commission, a rate review commission, which would take a look at if a drug company chooses to increase the drug cost by a certain percent, it needs to go to this review commission, just as you would for utilities. Utilities have to go to the PUC. Insurance, your health insurance premiums, they have to go in front of the insurance commissioner. So the concept is out there already. That's passed out of the House. We're hoping that the Senate version will work okay. They're looking at shifting some of those really progressive bills to task force to have that looked at. But that's still a win. That's still a win. With that, I'd like to also talk to you a little bit about one of our other key pieces, and this is something that I hope we're able to do more of, and I think I'll try to get that out to Rick. Barbara's familiar with it to some degree, but it's a product or software that we use to help us track the legislation. You know, you folks have had Jim and other means to track legislation. I'd like to send out a report so you see what we're looking at. And it's a way to help us track all the numerous bills that AARP is tracking. But we'd be interested in knowing if any of you are similarly interested in that kind of information so that we can look at maybe sharing that. It's very timely. We get the information right away. It basically will take the bill plus the House, say if there's a House Draft 1, it automatically does a merge and compare so you can easily see what the changes are and just gets information out in that way. And to me, again, that's another way of just how do we share information and not duplicating effort, and hopefully there's a way that AARP Hawaii can be a greater resource, a better partner, and I'm eager to have folks contact me directly. Definitely want to have AARP be seen as a partner that provides value. Thank you.
All right, thank you, Kealii. Last week, so several people in here were on different things. So there's also the AARP Club number 60 that Barbara actually is president of, that meets on the first Wednesdays of every month. Right now we're meeting at 15 Craigside for lunch, and they have great speakers as well. Also, she mentioned, Kealii mentioned a program for tracking bills. You're probably all aware, because you're here, of the PAR, the Public Access Room. It's huge to sift through, so something like that is very helpful. Poki'i, sitting here, so she presented a few weeks back. She's also the co-chair of the Kokua Kapuna committee at the Rotary that we're in, and we're on several boards together as well. And one of the things that we do also is with Alzheimer's Association. I did not have them come here, but I just wanted to mention that last year we passed a bill that we're pretty excited about to fund a coordinator position, and it just lingered. It lingered, and this year we suddenly discovered, I don't know when we discovered, but it wasn't written correctly. So because we asked for a full-time position, it actually didn't get fulfilled. So this year we have to work on getting one FTE written into it, and it just last week passed the financial committee. I went and did some testimony there. So we're very busy with a lot of the Alzheimer's stuff. We have a few bills that we're looking at as well. So here as a Kokua Council, part of what we're doing here today is having folks present, but also to hear about the different issues that are out there that we as individuals can support, both as a Kokua Council, but also as individuals. So that's a big part of what this program is all about, and many of the presentations that we have are all about. So at this point, I want to open it up for questions of all of our panelists that presented. So anybody have any questions? Doug?
Yeah, you're mentioning legislation. This question goes out to all the presenters. Do they have specific bills now that the legislature is in session to follow? If they want to describe it a little bit, give us the numbers so we can track it.
Good question. Did everybody hear that question? So he's asking the panelists for what specific bills folks are actually supporting at this point. So, okay, Lily has some, I bet.
One of the bills was our priority bill, and I talked about the issue of Hawaii Saves. And so the only vehicle that we have alive at this time is Senate Bill 2490. It was introduced by Senator Taniguchi, and it passed out of Ways and Means. last week. So it'll be crossing over to the House. We are eager to have the House have the bill at least make it to conference and not have it die in committee as the House version did. If you're interested, I can rattle off a bunch of bill numbers related to prescription drugs, presuming that you folks have an interest in those things. A couple of ones, actually, I'll make reference to. There's a bill related to long-term care, and it requires the Office on Aging to just update. Many of you may know that a report or plan was put together, I think, almost 10 years ago, and it's called HB 1871, and the concept is just to have that updated. There's one related to insulin, and putting a price cap on insulin, that's HB 1796, or actually it's going to be way easier. I can send this out to you. I'll give the actual report to Rick to share with you. There's another one on elder abuse and exploitation. It's called the Silver Alert, kind of like the Amber Alert, but for kupuna, and that's HB 2220. One of my favorite bills I'll share with you is that Rate Review Commission. Our testimony has basically been in support and advising that rather than have that become a task force, to actually move it forward. And that's the rate setting commission, and that was introduced by Representative Takumi. It's HB 2561. There's a wide range of other prescription drug, some related to health insurance and other areas. So I'll get that out to Rick. I don't want to take up all the time if other people have bills that they want to highlight.
Okay, so Calvin's got a couple to add here. How you doing? Oh, okay.
We know the same bills.
All right. So, okay, Dr. Balaz here. Well, you gonna stand here?
Yeah, come back. So some of the bills I think that Calvin and I are both involved in with the Alzheimer's Association Kupuna caregivers. So one of them was already mentioned. It is the Silver Alert. So we just recently had testimony on that. We also have, all of these have House bills and Senate bills attached to them. So we have House Bill 1873, which is looking at the Department of Health to establish basically a workforce or training program for everybody who works direct and indirect care for those with Alzheimer's. So the last with that is that it would be part of more of a work group. We've had some alterations in that. Another one is Senate Bill 2563, looking at the first responder training for people with dementia and Alzheimer's. Then House Bill 2455, that is the same bill on the House side, excuse me. Senate Bill 2342 is looking at the Kupuna caregivers appropriation, looking to expand it, asking for increased funding, and going outside of just the ADC, but looking at in-home respite care. And then we also have, where Rick mentioned, we're correcting the language so that we can get that position filled. And we have a couple more. Yeah, the training. So I mentioned those two. So the first is for the first responders, and the second was for the workforce development for everyone in direct and indirect care. The Silver Alert, expanding the Kupuna caregiver program, and correcting the position. So that was part of the Kupuna care package that we just sent out.
What about the one telling doctors that they have to tell?
Oh, thank you, Barbara. Yes, we do have, that is another one that was part of the package that we put out. So there is already a Medicare CPT code that allows providers, both physicians as well as APRNs, to expand services for those that come in and get a diagnosis of dementia. What I mean by expand services is it's a code that helps to reimburse us for planning services, because we're finding out that less than 1% of people who get a diagnosis come in to get comprehensive planning services. And so although this already exists, and it's kind of in the Improving Hope Act, which is at the federal level, at the state level, we're convening a workforce task force to educate both physicians and APRNs that this already exists, and if we can get it to be implemented.
Do you have the number?
Yes, it is on here. I have all the bills. Let me scroll up and down. And you know what, and I have to add that when we're looking at the workforce for the first responders as well as direct indirect care, we're looking at a workforce and more of a standardized curriculum. Now, when I say that, we have no idea what that's going to look at. We do have quite a few evidence-based programs already here in the islands, like the Best Friends the Plaza uses, Savvy and DWD that we use in the community, and that Lunalilo Home is rolling out. So we are looking at kind of what we already have here to see what we want to use as the standardized to kind of be put out there. And hold on, Barbara, I am going down the list and I will get you that number for the physicians. Right here, House Bill 1873 and Senate Bill 2340. All right, Calvin, you want to add anything?
Just one piece is submit testimony when you hear about the bill and you know the details of the bill, because that's what the legislators are looking for. What does the public think about these bills? So it's so easy now to submit testimony. You can do it in person, of course. You can do it by fax. You can go online to the Hawaii State Capitol website and do it online. There's so many different ways now. But if you look at the testimony that's submitted for any bill in the House or Senate, there's very few testimonies that get submitted. So our legislators need to hear from the public, from their constituents on the bills you're passionate about. So the hard part is keeping up with all these bills that go from one committee to another. So we're well into the session. So as they get assigned to committee, and the finance is the one that, of course, everyone knows is one of the most difficult committees to get a bill through if there's money involved. But that's where they need to hear what are the priorities of the constituents, of us here.
So on that, the more testimony you actually submit, people submit on a particular bill, the more attention it gets. So I was told early on in my life when I started doing testimony, if somebody hears something from one or two people, they're like, oh, okay, that's interesting. But if they hear from 100 people, like, oh boy, I better pay attention to this, right? And when you do submit testimony, I mean, there's several things that we do, and we can do a whole training just on that alone here if you're interested. So I'll let it go at that. Are there other questions? Yes.
What was the HP for the first responder?
What was that? Is that the 18?
SB 2563. Sorry? SB 2563.
Everybody hear that? SB 2563? Sure. So let me do one other piece though. So this hearing aid, so some of us are in the Legislative Kapuna Caucus, and we actually picked 10 things that were actually forwarded. And one of the issues that we thought would get forwarded that didn't make the top 10 list was hearing aid coverage, which AARP had tried to do. How many years in a row did you guys try that?
I think
About 3 years, and before that, the Lions Club. So again, hearing aids are not covered. So that's why we're doing this program through the Rotary. It did not get submitted as a bill. So next year we want to try to... It went in as a bill?
It never got a hearing.
It never got a hearing. So that's the other thing. So some of it is with these is the importance of submitting testimony around these things is really around that, just so it does get heard. Okay, and there's a whole process. Did you want to say something?
So sorry. Yeah.
If I could add to that, the hearing aid bills were carried over from the 2019 session. The hearing, and then they were also reintroduced in the 2020 session on both sides of the legislature, and neither one of them got a hearing. But the two bills from last year could still be I don't know if the word is re-upped or reinstituted, or they're still under consideration, whereas the 2020 bills are not. I have written to Senator Baker, who actually was the author of one of the bills last year and one of the bills this year, and asked her, I told her I was very disappointed that they never got a hearing, and was there a possibility of reinstituting, or again, I don't know the term, the 2019 bills. But if that isn't done, I believe by this Friday, that's it for the 2020 session. Thank you.
So if folks here have questions on legislative stuff that isn't necessarily getting answered, we're going to hang out here for a little bit, but you can always reach out to us. There's several people in the room that are pretty active. Percy?
They should go to Kupuna Caucus.
So yes, so the Kupuna Caucus. Do people know about the legislative Kupuna Caucus here? How many people go to that? And I recognize several folks here. Okay, so that's on, which Friday is it? First Friday of the month. We're doing from 2 o'clock to 3 o'clock over at the state capitol. So Senator Marawaki and then Representative Takayama, they actually head it up, and Lester Hara used to be the head of it. So we usually have a bit of a presentation there, but we also talk about bills, where they're at, where they're going, ways we can support them, okay? And they actually sponsored 10 bills each year. So we have 10 bills that we had sponsored going into the year, okay?
Sorry, real quick. We went to a training with some of our senators and representatives, and they were saying when it comes to giving testimony on the bill, that for them they really want to hear the stories, the personal stories, and not only that, they want to hear from their constituents. Even if it's a general thing that affects all of us, they will pay attention more if more from their community right specifically to them. So it's not only hitting us at the, when we're giving testimony for the bill at the committees, but also writing to your individual senators and representatives to let them know that you're interested in it so that they come together as one. That's all, thanks.
Yep.
Oh, can you ask some other questions?
Yes.
I was wondering on the Meals on Wheels group, how do you guys get funding? And also, my uncle was not eligible because they said there's nobody to deliver to his department, and I wonder about the constraints you have with delivery or what is our
Does everybody hear the questions?
No, repeat.
So they're asking about funding, and they're also asking about delivery issues.
Okay. I'm with Hawaii Meals on Wheels, and we get funded possibly through 5 different sources. One of them, our main funding, is through the Older Americans Act, which gets passed down from the state to from the federal government, state, and then the city. And the Elderly Affairs Division is in charge of that distribution. So what happens is that if you qualify under them, they will fund your meals as long as you are assessed by their case managers. They go through a whole assessment process. The second way is we have Medicaid clients, and that comes in through the Medicaid client's specific insurance. So we, at Hawaii Meals on Wheels, we have partnerships and contracts with Ohana, Kaiser Medicaid, MedQuest, that kind of thing. The third way is we have a partnership with Alulike, which is not through the Older Americans Act, but through Title IV, which is Native Hawaiian and Indigenous people. So if you qualify for service, they will pay for your meals, and they send their case managers out to assess the client. And then the final way is we have a number of clients that come in who don't fit under any of those fundings, and they come in for a private pay service. And we send our case workers to go out and assess, and then the cost of the meal depends on a financial assessment as well. Because our pot of money to be able to sponsor our clients depends on how much private donations we receive every year. So then we probably sponsor about 50 to 65 clients, whether it's partially or fully sponsored. And those are for clients who don't meet any of the other funding requirements. For the hot meal service, depending on where, I'm not sure where your uncle. Oh, okay. That should not be a problem for us because our Kaka'ako clients, we have a number of routes in that area. The meals come out of Straub, and it's really just depends on, which funding source. If he wanted to go through the city, then it does take some time to go through that assessment process with them. Yes.
I hear a lot of presentations, and it seems like unless you're in the city or the state, they don't have a voice. What I'm concerned about is the little grandmother who's widowed and calls or has a caseworker come out. And what I have witnessed is that the caseworkers, even with Meals on Wheels, they'll just give them a pamphlet or a brochure and like call. And when they call, they get recordings. They don't get real people. Or when they call, they're told, like the lady here, that they're all filled up and try in another 3 months, they'll put them on a waiting list. And unless they diligently, continually call, they don't hear nothing. And those are the people that need help. A lot of the state workers, all these programs, you're sort of absorbed before the person who's sitting there in their lone apartment or widowed or really elderly that do not have the support to even help them with filling out these forms. Also, when they try calling to see how their name is progressing on, quote, the wait list, it's almost like as if there isn't a list. It's almost as if unless you call back diligently, you're like, it's overlooked or there's no list to really follow through with these. And those are the people that need these services. The same with all these community clubs that are helping. It seems like unless you really know someone in there, you're not aware that, like Rotary, I know that one of the main things you do is hearing aids. And yet a lot of the community, they hear of other things, but not that.
Right.
And they should be really promoting these kind of things to the, not to the working woman, but to the ones that are really there alone in their rooms. Because they don't, my mother still believes that they call her back, and they don't. And I know hearing at the legislators, they'll say that the supervisors will tell them, unless it's really important, they'll call back again. The other ones just keep on just servicing. So how do they really get through to these services that are out there, the little grandma?
So I'll echo what Michelle said. If you call right now, you'll probably get the same response we do, which is there is no wait list. And that's certainly from the provider side, neither organization has holds. So we are able to serve the community as they need us. I think one of the things about getting to us, as Michelle was talking about, is there's a difference between someone calling and saying that they're going to pay out of pocket for their service, in which you're dealing directly with us as Meals on Wheels providers, or they're trying to have the service paid for by another funding source. If they're going through that other funding source, like Medicaid, like the city and county, like Alulike, then they are working with their staff, and those funders are managing their own wait lists. If we're aware the family is trying to work with these funders, we certainly on our end can also prompt and try to remind and also kind of track the status of someone. But that person doesn't even necessarily come to us until that funding source has approved them and is sending a referral over. So unfortunately, I think some of it is having to be proactive with the service. And if they feel comfortable contacting us so that we can kind of also advocate on our side, then we can have some of our staff try to follow up as well.
So Helen, I completely agree with your frustration. That is exactly the frustration both of our staff are dealing with every single day. Because we as Meals on Wheels providers get very stuck in the middle, and we're not sure why the client is not getting approved by the city or Alulike or by Medicaid. We're not quite sure. And what we do on our end is when we hear the name and the client is really frustrated, we then are sending emails to that state agency or city agency to be like, we heard about this case, 70-year-old woman, she's incontinent, blah, blah, blah. Where are you guys on the status of this? And we see clients getting bounced around to our disappointment. And not only just for service, but also with adult protective services. And that is an even more difficult thing to see when we see a client who is needing service from adult protective service, and they're not getting a response right away. So I completely feel your pain. I think as providers, we've seen an increase in people wanting more private pay because they just can't wait. They can't wait anymore for city or federal funding and so forth. So they're saying, can I at least pay $2 for a meal? And we're like, sure, we'll serve you tomorrow. But you're right, we're kind of confused as well. We're told there's no wait list, but at the same time, we're also told that clients aren't qualifying. So it's, yeah.
So one of our goals, so I'm actually on the board this year with Hawaii Meals on Wheels and Secretary on Programs Development. And one of the goals is, so I've been in the field of clinical case manager for many, many, many years. So one of my goals is to try to sort out how they assess people. So I can tell you when I was right at home manager, which I'm not at this point, but when people would call in and they would try to get on the Kupuna care, the bill, to get some services funded, what people would get in response was that we have a very, very long wait list. The program actually hasn't been enacted right now. Could you call back in a few months? And so when we in Legislative Kupuna Caucus asked them for a list of what the wait lists are, we're told there is no wait list. There's no wait list because they're not taking names. So some of it is approached us very kindly, very nicely. Try to meet with the department heads. There's some changes that have happened. Try to sort out how they do the assessments. I've gone through this with developmentally disabled as well, which I worked with for many, many years. Try to sort out what the assessment process is. What's the appeal process? How can we advocate? How can we, so my wife and I deliver the Waikiki dinner route, and we had some folks that actually dropped off that were disqualified. One person died. So it's pretty dear to my heart to try to sort out how do we serve folks that really need the services. But more so, how do we team with your department, to try to help? How do we help us as volunteers, or us as the Meals on Wheels folk, understand what the process actually is? How do we do it in an open, kind of together, kind of working and helping each other kind of way? And so that's what I'm hoping, we're hoping this year, to kind of open up and explore. There's been some changes in the departments, so we're trying to approach it that way. And that's what advocacy is. Not just going after folks, not being, of course we're upset about situations, but using those stories as ways to kind of learn and try to be proactive and try to move forward in a more productive kind of way. And that's what we're hoping to do going forward. And we're hoping to use this council to help us with some of this as well. This council has a lot of energy, has historically had energy around issues that are Kupuna issues. Hearing those stories and then trying to shape them in a way that help us grow towards solutions. So I always say you can be part of the problem or part of the solution. This is my mental health hat, which I've worn for many, many years, and I choose to be part of the solution. So try to hear the problem, try to listen, try to gather enough information that then we can kind of move forward and try to help others do the same. There are personalities out there, though, that we will encounter along the way. Other questions? Yes?
How much funding do you have? How many hearing aids can you give out a year?
So, actually, I was going to address it because Helen brought it up. So, the reason folks are just now hearing about the hearing aid issue is because we just started the program. This program only just started. So, the Rotary, currently our Rotary, the Rotary Club of Honolulu, is funded $1,000. The application fee for the free hearing aids for folks that fall under the poverty line through the Miracle Ear Foundation, the application fee is $150, and there's a number of people that can't even afford that. So we're gonna help cover that. But I've also since then connected with some other folks that want to help us with hearing aids in different ways. This is just a pilot study. Naomi and I have talked about how to help the Rotary kind of be a part of focusing on hearing issue, because the hearing issue is a huge, huge issue that we really want to try to help. So we've only just begun. I have connected with an owner of another hearing aid I won't go into just yet that is willing to do some free stuff. We'll see how it all plays out. This is just the beginning of what I hope to be a pretty ongoing and pretty substantial kind of program. We've just started. Okay, so what is that, $150 at $1,000, I could probably get about 8 hearing aids covered. We have a number of Rotarians that are willing to pitch in, though. So far, you know what? So I've put it out. I put it out here. I was on Good Morning Hawaii show with Annalisa Burgos a while ago, just a few weeks ago, advertising. I've yet to have a request for hearing aids, so there's that as well. Percy was kind enough to put an article in this generation, so it's getting out. It's slowly trickling out there, the information. But I expected, as soon as I put it out the first time, even just here with Robert here, the Miracle Ear owner, I expected to get some referrals right away. I haven't had a single referral so far. But I'm using my cell phone number, so it's pretty easy to get a hold of me, and I do answer it. so there's that. Other questions? You, Helen?
Can you tell us a little bit about Generations Magazine? Because that one we do see in the community for the seniors to grab it and get a lot of information.
So Percy's magazine is remarkable. So it covers a lot of things. And you want to come up and tell them a little bit?
Well, everybody's seen a magazine. It's every other month, 6 times a year. We try to feature great stories like this one on medical aid and dying. Our website has a lot of information as well, Generations 808. It has all the past issues as well, all our past radio and TV shows also. But we're a big advocate about being proactive in life and, trying to be an advocate for your friend. These stories are quite common in Helen, but we really have to be an advocate and be a resource for everybody as well. So that's what we've been trying to get. A lot of our partners here, Greg, Michelle, everybody, all our partners, Eileen, Calvin, everybody's been a part in the magazine, provide a resource out in the community. And we're always looking for stories, events, nonprofit, people that serve in the community. We did a couple of stories on Rotary already, Lions Club, but just really try and get active. This group is really good and growing. Thanks to everybody here. We're going to grow even further, bring your friends, and besides this, in Kokua Council. But this one I like is this is about the only place I eat pizza. I don't like pizza, but I love pizza. $5, you can't beat that deal. But yeah, it's just a great group, and we support all the things that are senior. But thanks for the question, Alan.
So the how do you say it? The genealogical.
Okay. Gerontological.
Are you the ones having that fundraiser in April?
We're doing a fundraiser in April?
We usually have one in the fall.
Caregiver Foundation has one coming up in April. Yeah. We can probably have Gary come and speak also at some point. We do a scholarship fundraiser. Was that September? No, in November. So Helen, you did the HPGS. We did the fundraiser in November. We honored Barbara, who had retired. So that's raised money for the scholarships. We do that every November.
Every year we get together and do a big dinner for somebody in the community who's done something for our kupuna for years or whatever they've accomplished. And this year we have I'll just announce here that Colin Hayashida is going to be the honoree this year, and the dinner is usually in November. It's a fundraiser for the scholarships.
Perfect. And we've done it at Kahala Nui, as where we were last year. So we're going to do that again this year. We're wrapping up. Any other questions? One last question. Everybody good? Do you guys know about next month's presentation? So next month's presentation is huge. We already have somebody doing a sneak peek here, Coon James. So we're going to have the mayor candidates for Honolulu come and present. I've got most of them invited already. So here's how it's going to kind of go. We're going to ask for questions in advance so we can get them out to them. And of course, we can do a free-for-all here as well. And they're each going to present their platform. They're going to bring their flyers and everything here as well, so you have access to that information as well. There may be some, like today there was a little bit of media coverage, might be some media coverage as well. So really encourage you to come back for that. And the month after that, we have some exciting kind of ideas. I won't put it out there just yet because I need to ask them if they want to do it. So open to suggestions anywhere along the lines as to how this is working for you, the presentations that we're doing, interests that you have, or just topics that we should kind of research, kind of thing, okay? So we really appreciate everyone being here. And Barbara?
I just picked up, a couple weeks ago, that the new legislative directory, which I thought was last year's because it's exactly the same, but the color scheme is upside down. But anyway, I have about, I don't know, 10 or 12 sitting up here if anyone would like one. Thank you.
So we have a bunch of other handouts if you didn't get them. Check out the desk here. So HPGS, the registration stuff. Naomi brought some stuff from the Rotary. Looks like we have 1 Generations left. I have more in the car if people didn't get it. Just let me know, or Percy probably has some as well. Sherry probably does too. Okay, everybody good? All right.
Thank you.
Take a slice of pizza with you to go.